Rhonda Sandel.
Thank you, Senator Schwartner. My name is Rhonda Sandel. I am a nurse, CEO of Texas Emergency Care Centers. 2 of our facilities are located in the greater Houston area. Both of these facilities remained open and operational 24 hours a day, 7 days a week throughout Harvey and the immediate aftermath. Our patient census more than tripled during this time. We took care of many critically ill patients, including amputations, heart attacks, strokes, head injuries, GI bleeds, and pediatric hemorrhages following a tonsillectomy. Many of these patients were either uninsured or had Medicare and Medicaid, and as I'm certain all of you are aware, freestanding emergency rooms are unable to be paid for any treatment that we provide to these patients. The Atascocita facility became an island and was the only emergency room open that CMS or the public could access. When it became apparent that EMS could not reach the local hospitals, the fire department notified us that we were being designated as the primary receiving station for EMS traffic. From that point, we collaborated with the local EMS, the Coast Guard, and the Southeast Texas Regional Advisory Council. We became a critical resource to the community and to the local emergency disaster management program. Based on our experience during the disaster, I have 4 recommendations. First is that all freestanding ERs must become active in their Regional Advisory Council and become active in the local emergency preparedness, trauma, and disaster management program. Second, local EMS authorities must recognize and build relationships with freestanding ERs. Currently, the law requires that independent freestanding ERs hold themselves out to local EMS, but it does not require EMS to recognize freestanding ERs. Third, I strongly believe freestanding ERs should become staging areas and act as primary receiving stations during times of disaster. This allows local EMS authorities to stay within their community, thus allowing quicker response times and better utilization of resources. Fourth, the state must find a way to help independent freestanding ERs be reimbursed for Medicare and Medicaid patients we treat. This means the state would have to provide support for CMS recognition for the independent freestanding. Prior to Hurricane Harvey, there were arbitrary rules governing why these things couldn't happen, but what this natural disaster has taught us is not only that they can happen, but for the sake of public health and safety, it needs to and must happen. I have given each of you a copy of letters written by CETRAC and the Atascocita Volunteer Fire Department on behalf of Texas Emergency Care Center. These letters have been submitted for consideration to CMS, the U.S. House of Representatives, and the U.S. Senate. Thank you for your time, and I welcome any questions.
Thank you. Members' questions?